Today's a little bit more of a personal video. It's 6 things I do in my skincare and beauty routine as a dermatologist that I think a lot of people would find surprising. And I'm saying surprising because I feel like these are not the standard beauty tips that you've heard 1,000 times, but they work really well. They really do elevate your beauty and skincare routine, and I talk with my patients about them all the time, so why shouldn't you get the inside scoop too? If you're new here, hi, I'm Dr. Sam Ellis. I'm a board-certified dermatologist practicing in the San Francisco Bay Area. And this channel is all about breaking down skincare and hair care for you in a way that is actually useful and giving you great product recommendations as well based on my expertise and my insane pickiness. If you like that type of content, give this video a thumbs up and subscribe to the channel. I post videos every week and I really strive to make each one worth your time. So let's jump into these little tips and tricks and make sure you stick around for number 4 because it's pretty unconventional, but it works extremely well. A lot of how I take care of myself and instruct my patients to take care of their skin and hair is not just based on my training as a dermatologist, but also experience in seeing patients and seeing how patients age and what problems they struggle with as they get older, and then changing my habits now to do a little bit of prevention. So the first thing that I do is I apply my topical Tynanoin, my retinoid, very carefully around my lips and around my ears, which I think are areas that people often don't apply their retinoid altogether. I didn't really realize this was a surprising thing until I started getting called out because I often will do my skincare routines in my Instagram stories, and so many times people are like, wait, you put your Tynanoin on your ears, or do you put your Tynanoin directly around your mouth? And yes, I definitely do. And I'll be honest, the thing that really motivated me to do this was seeing patients year after year in clinic, and they had been very consistent with their topical retinoid use on their cheeks and forehead, even their neck and chest, and that skin all looked great. But then you would get to their physical exam and you'd look at their ears or you look around their lips and they have tons of little lines or tons of sun damage. And certainly that is also because people tend to under apply sunscreen there. But I also clocked it and was like, okay, well, I'm going to prevent with sunscreen, but I'm also going to correct those areas by applying my Tynanoin to my ears and very specifically around my lips. The satsnoi. I love this because it basically takes no additional time or effort. Sasmaksao. I take whatever's left over on my fingertips after putting Tynanoin on my face, neck, and chest, and I just rub a little bit over my ears, my earlobes, and I just make sure I get it around my mouth. Now, we do know that the skin on the ears and around the mouth is a bit more sensitive, so I have slowly worked up to being able to use my Tynino in there consistently, but I am really nervous about getting those vertical lip lines. I mean, I know it will happen, like aging is going to happen, and I'm not trying to fight it, but if there are easy things I can do to prevent or correct it, why not do that? Putting a little extra cream around my mouth is no big deal, and it's just a nice preventative step. I often will simplify a morning routine and a nighttime routine, as morning is for protecting and nighttime is for correcting. So I put my sunscreen very meticulously around my mouth, on my ears, on my entire face, neck, and chest every day. And I put my retinoid in all of those same places at night. The second thing I do that might be a little bit surprising or unconventional is that I use minoxidil, also known as Rogaine, not only on my scalp, but also to help my eyebrows grow and to help with my nails. I talk about minoxidil for hair growth a lot on this channel because I specifically within dermatology specialize in hair loss, but a lot of people don't realize that you can use over-the-counter 5% or even 2% topical minoxidil on other areas that you want to grow more hair, including the eyebrows. Minoxidil is the only FDA-approved topical for scalp hair regrowth, and it works by prolonging the anagen phase or the growth phase of the hair follicle and also driving better blood flow to the follicle. So when I am using minoxidil on my eyebrows, I'm technically using it off-label, but we actually have many good clinical papers now that show that consistent application of minoxidil to the brows helps with growth there as well. For me, I just find this to be a very easy, high yield thing I can do in my routine. It's very common for women as we age to lose our eyebrows. So they can thin out. They also can be lost due to certain medical conditions like thyroid conditions, anemia, and a lot of women also over plucked in their earlier years. So if you're trying to help promote brow growth or regrowth, minoxidil is a really nice, safe, well-tested option. Now, when I'm applying minoxidil to my scalp, I like to do it at night. I will put it on my scalp and then I'll kind of put my hair up and go to bed. But when I am doing it for my eyebrows, I actually put it on in the morning. And the reason for that is I am a side sleeper. And if I were to put my minoxidil on my eyebrows and then go to bed, there's a really good chance I would be smearing minoxidil all over my face. And although I want more eyebrows, I don't want more upper cheek hair as well. Whereas if I put my minoxidil on in the morning before I go in and apply my brow gel, I'm not going to be touching my brows for many hours. So I don't have to worry about that minoxidil transferring to somewhere I don't want to grow hair. When I apply it, I'll usually, take a little spoolie and then dip it into my minoxidil solution or the foam and make sure there's no excess so it's not going to drip. And then I will comb it through my brows on both sides. I've also seen people apply with a makeup brush or even take a little Q-tip and apply if they don't have enough hair to run a spoolie through. And that's typically something I would do at the end of my makeup routine, but right before I apply my brow gel to sort of set everything in place. And then I also mentioned minoxidil for the nails as well, because there's some early data to suggest that applying minoxidil sort of to the base of your nail, we call that the nail matrix, can help the nails grow longer, faster, and thicker. I have struggled with my nails my entire life. I was just not blessed with thick, fast-growing nails. So I will take any little tip or trick in the book to help with that. So when I apply my minoxidil at night, I just make sure I kind of get my nails in there and I get a little extra application on them. I don't actually take take out extra minoxidil and put it on, but I also don't wash my hands after I put my minoxidil on so that I do get those positive nail effects. And I definitely always do that before bed because I want to do it at a time where I'm not going to be washing my hands right away, but also am not going to be touching my face. Now, a couple of quick caveats. Minoxidil is not for everyone. So if you are trying to conceive, you are pregnant, or you are breastfeeding, minoxidil is a no-no. I also like to mention that minoxidil is toxic to cats and dogs, especially because I'm talking about applying it in a slightly unconventional way on your eyebrows or on your hands. And if they were to lick your face or your hands when you had minoxidil applied, it can be lethal to them. So you need to take special precautions if you have cats or dogs, or maybe not use it in that exact way. I have lots of information about minoxidil on this channel, and I have lots of strategies around it if you do have pets. So make sure you check out those videos. So the third thing that I do every single week without fail is I do a full body chemical peel. And maybe out of the gate that sounds really intense or extra, but one, I am extra, but two, I have techniques so that it's not intense. First of all, the reason I do this every week is it not only makes your skin smoother and brighter, but it also helps strengthen your skin barrier over time and can even help with collagen production. And I just find so many people hyper-focus on their facial skin and they kind of neglect their body, and then they get into their 5th or 6th or 7th decade of life and they start being bothered by skin on their arms or their legs. And although that's not entirely preventable, like we are going to age, and that is totally okay. There are things that you can be doing earlier in your life to help keep your skin as strong as possible. I'm also not doing intense chemical exfoliation where I am visibly peeling or shedding like a snake. I'm just applying something very consistently to keep my skin as smooth and strong as possible. I really like to use my Prequel Multi-Aid Milk Peel for this. It is potent but gentle. I feel like there's a misconception around this product that it's only meant for face, but I actually think people even have more success when they use it on their body. It does have 15% glycolic acid, which is not only a fairly high strength of glycolic acid, but glycolic acid is also the strongest of the alpha hydroxy acids, but it also has phytic acid and maleic acid and lactic acid and mandelic acid, sort of these supporting more gentle alpha hydroxy acids. So you get a very comprehensive exfoliating experience. Not only do these acids help break apart those dead surface, dead skin cells to make your skin smoother, they also draw water to the skin surface. They can act as HC tants. So the skin is going to plump out and they can stimulate collagen. They can turn on your fibroblasts, your collagen producing cells. So over time, with consistent exfoliation, you're also going to have thicker, plumper, healthier skin. It's also a really big bottle, so you can be very generous with this product. And what I'll do is once a week when I am done with my shower, I will towel dry off and then I will shake up the bottle and then I will just shake a bunch into my hands and I will apply it neck down. I also pay special attention in applying it to my elbows and my knees and my feet because these are areas where dead skin tends to accumulate and can make those areas look dark or rough, and I'd like to not have that. The other thing I really like about this peel is you don't have to wash it off. So I just let it set for a couple of minutes and then I will go in with my body lotion right on top. This also can be a particularly nice thing to do if you struggle with keratosis pilaris, lovingly called chicken skin by the general public, where those like rough and bumpy spots show up on the arms or the legs. Doing some regular chemical exfoliation can be a very effective way to help keep that in check. I was actually at the American Academy of Dermatology meeting in Denver a few weeks ago, and a dermatologist colleague was saying goodbye to me, and she like touched my arms and she like turned around and stopped and was like, "Your skin is so soft." And that's actually a compliment I get not infrequently. And I definitely think part of that is attributable to the fact that I exfoliate regularly. And sometimes I feel like people hear all this good stuff about exfoliation and they just think, okay, I'm just gonna do it more and more and more. But exfoliating 1 to 2 times a week is absolutely adequate and is going to yield you all of those benefits without having to have it be a part of your daily routine. I will also link some other body exfoliants that I think are wonderful in the description box. So in case you don't have access to Prequel Multi-Aid Milk Peel, you can still have this be part of your routine. And you can either use a dedicated body exfoliating serum or just have it be an exfoliating lotion that you apply. Okay, I think we've arrived at like the 4th surprising thing I do, which I was talking about a little bit at the beginning of the video. And it's pretty unconventional, but it works super well. And that is, I shampoo my hair with my head upside down. So why do I do this? And to understand my reasoning, you really have to understand what the purpose of shampoo really is. I think because it's in the hair aisle, people really think of shampoo as a hair wash. But first and foremost, you should be thinking of your shampoo as a scalp wash. Every single day in clinic when I'm doing full body skin cancer screens, I look at people's scalps, and so many people have a ton of residue and buildup on their scalp, whether it's hair product or oil or dirt or sweat, or often a really lovely combination of all of those things. And the reason that buildup occurs is not because people aren't using shampoo, but because their shampoo is often struggling to reach all the way down to their roots and onto their scalp. And so the reason I will have patients with thicker or denser hair flip their head over when they shampoo is because it helps lift hair off of your head, because gravity is pulling it away from your scalp so that you can really get your shampoo down onto your scalp where it's going to do its most effective and important cleansing. If you are not adequately cleansing your scalp, that is going to predispose you to flares of conditions like dandruff or seborrheic dermatitis. It may mean you have an itchier scalp. It also usually means that your hair gets oilier faster between washes. So you feel like you have to wash your hair more often because when you're washing your hair, your scalp isn't fully getting clean. This is one of the reasons why when you go to the salon and you get your hair done and blown out, your style lasts for so much longer. It's not just that they know how to style your hair well and they're putting good product in your hair. They're also very, very thoroughly cleansing your scalp, and that's why you get so many more days out of that wash. So don't be afraid to flip that head over, baby. And the other thing I tend to do when I shampoo, and I only shampoo a couple times a week, which is why this next step is important to me, is I will double cleanse my scalp. I will shampoo twice. I use that first round of shampooing to really lift up all of that gunk and grime. And if I feel like my hair is relatively clean when I get in the shower, I don't necessarily do a second cleanse. But if I do feel like I've been using a lot of dry shampoo or it's been a few extra days in between my wash days, then I will go in with a second cleanse after I rinse out that first round of shampoo. And you can use the same shampoo for both cleanses. You just do one rinse and then you do it again. But now that I'm also treating hair loss because I have androgenetic or female pattern hair loss, I actually use a hair loss shampoo as my second shampooing step. I really like my Move Full Follicle shampoo. I also like ketoconazole shampoo to help with hair growth. So I often will go in with that as my second cleansing step. So if you have thicker or longer hair, or you're just wondering if you could like up your scalp and hair game a little bit, try flipping your head over in the shower. Try doing a double cleanse on your scalp. I feel like this will be a game changer for some of you. Moving on. Another weird or sort of surprising thing that I do in my skincare as a dermatologist is I pretty much always apply my sunscreen in 2 layers in terms of your sunscreen being effective and for you to get the protection that is stated on the bottle. So, for example, SPF 50, that relies on you applying a thick and even enough layer of sunscreen on to protect you. If you are applying your sunscreen with a light touch or sparingly, that's going to give you a sun protection factor of like 5 instead of 50. The amount of sunscreen you need on your face to have consistent full protection is 2 microderm per square cm of your skin. And that value sounds pretty abstract, but that's going to average out to about a 4 teaspoon of product for your face. The reason I like to apply my sunscreen in 2 layers is because a quart teaspoon of product can sometimes feel like a lot to smear on all at once. And in the past, when I've tried to do this, I just felt like the sunscreen wasn't applying very consistently. So now what I do is I take about 1 juicy finger length of product, which is about 1/8 of a teaspoon, and I will rub that in first. And that really allows me to focus on making sure I get around my eyes, I get my ears, I get up near my hairline. I'll let that set down for a second, and then I'll go in with a second layer of sunscreen to kind of fill in any gaps or holes or places I've missed. And it just feels a lot more precise and intentional. So even though I'm applying my sunscreen in 2 layers, I'm not necessarily applying more sunscreen, but I feel like I'm applying my sunscreen with more precision. And I'm not trying to just smear around a big blob all at once. And the reason I recommend my patients do this method as well is because I find a lot of people under apply their sunscreen. So if they're doing a first application, they're kind of under applying with that, even if their intent is to do a full thorough application. So if I know they're going to go in with a second application, I can feel better as their dermatologist that they're going to have better, more consistent protection. And the final surprising thing that I do does involve professional treatments in the office. So I want to be upfront about that I recognize that might not be in everyone's budget, or not everyone might have access to this, but the concept of it I think is important and valuable. So I wanted to go over it, and that is the idea of collagen banking. Your skin's collagen production kind of peaks in your mid-20s, and then after that you lose about 1% of your collagen per year, and that really accelerates once you hit menopause. Now you can definitely slow that decline of collagen and maybe stimulate it a little bit with things like topical retinoids and SPF and antioxidants. But if you really want to stimulate collagen, that's usually where these in-off treatments are going to be more valuable. And for me, I tend to do these treatments a few times a year. These are not things that have a lot of downtime. I usually choose interventions that have 1 to 2 days of downtime. And I really consider them little skin nudges to help build up my collagen stores so that as I continue to lose them, I'm trying to keep up with it. It's the collagen treadmill, if you will. I have really powerful lasers in my office, like CO2 lasers and Frels. And those are great for stimulating collagen, but they do require more downtime. So I opt for these sort of smaller interventions more frequently. And I talk about this a lot with my patients. There is no perfect answer here. You got to do what's right for you and what works with your schedule. And half my patients kind of want to be like the once a year and done. And some of my other patients who don't have any downtime or are maybe a little bit nervous or apprehensive about these bigger downtime procedures, like to nudge their collagen along with more frequent things that are less intense. The 2 that I do the most on myself are microneedling and Clear and Brilliant. Microneedling involves tiny little needles that are sterile, and this is not painful because you're numb, that go in and out of the skin. And it's a very controlled way to injure the skin and stimulate a very controlled wound healing response so that your skin builds itself back stronger. And we have really robust data to show that consistent microneedling can help build up your collagen. And then Clear and Brilliant, which is also known as Baby Frail, it's made by the same company that makes Frail, is a fractional laser that creates these microscopic treatment zones within your skin to stimulate a wound healing response similar to microneedling. It also helps a bit with melasma and pigmentation. So that's just like another bonus of that resurfacing treatment. But the philosophy behind all of this is it's much easier to maintain your collagen than it is to rebuild it. So if I have patients who are concerned about premature aging, or they want to be doing all the possible things they can to keep their skin as plump and healthy and keep them confident as they get older, these are things that I recommend. So basically, instead of chasing the clock, you're staying ahead of it. If you found this video helpful, a like goes a really long way in helping this channel reach people who are looking for this kind of content, and subscribe if you want more. I cover everything from evidence-based ingredients to skincare routines to answering your clinical questions. So if you have any curiosity about dermatology and how to take better care of your skin, hair, and nails, subscribe to the channel and tell me in the comments which of these surprised you most. Are you already doing some of these or thinking about incorporating them? I would love to know, and I read all of your comments. As always, thank you so much for being here, and I will catch you in my next video.